here today in a slight triumph. As we all know, the Republicans have been defeated in their attempt to repeal Obamacare. However, we don't stand here just to oppose their plans or to celebrate their triumphs. We are here to demand actual health care for everyone. We still have 29 million people without insurance. We still have people going bankrupt. We still have people being thrown off of Medicaid. We still have people getting sicker and sicker because they don't have access to care. And we still have private insurers making billions off of us. Mitch, it ain't right. Mitch McConnell got one thing right yesterday when he said it's time to move on. And what is it time to move on to? Thank you. What do we want? When do we want it? We can't back down. We can't be happy with their defeat. We need more. We're still suffering. We need our elected leadership, including Senator Durbin, to demand Medicare for all. We need someone in the Senate besides Bernie that will stand up and fight for us. Senator Durbin, you said on Wednesday in an MSNBC interview that if you said, Senator Durbin, in an interview on Wednesday, that if the private health insurance industry can't make the current approach work, we're moving closer and closer to a single-payer option. But I've got some news for you, Senator Durbin. Private insurers aren't going to make it happen. Not at all. They're going to beat us. They're going to beat the system. They're going to cheat us out of healthcare. They're going to drop our policies. They're going to change our networks. They're going to change our benefits and not tell us. They're going to increase our premiums well above medical inflation rates as they continue to do. They will always put their profits over patients. And the ACA didn't change that. Didn't change it at all. That ain't right. In that same interview, you also said that people like Medicare. You said it gives them peace of mind. Why can't we all have that peace of mind? Why does it matter if you're 65 or 64 or 50 or 30 to have peace of mind? Why can't we all have that? That ain't right. You also talk about things such as a Medicare buy-in or a public option. Those things won't work. They're not an interim step. It takes sick people and it puts it on the government dime. And then private insurers cherry pick the healthy people. And they treat them all nice and like they're best friends, and they make a bunch of money off of them. And then the public program doesn't work. The only sustainable way is Medicare for all. We stand here today dying to represent those that we know who have died due to a lack of health insurance. And until we have expanded and improved Medicare for all, we will continue to have unnecessary deaths. We need it now. First, we're going to have a few speakers, and then we'll proceed with the die-in portion. So our first speaker is Brent Holman Gomez. All right, so Brent works in a long-term care works in long-term care for the elderly, and is with the Gay Liberation Network that is part of the international struggle for society to meet the needs of all. Please welcome Brent.
Thank you, Jordan, for putting this together today. GLN has been happy to be a co-sponsor along with the other groups here, the physicians and nurses that have gotten together to demand a system that is better than what employs them right now, which that's where we all need to be living, is in that mindset of looking for something better than what we have and what we're used to, even though that change may mean our jobs will change. So hats off to you. I am here particularly to talk about the immigrant experience with healthcare today. My lover is a Mexican immigrant who for many years was undocumented. Insurance carriers do not cover folks who don't have social security numbers. So we paid out of pocket. And Cook County hospital system and the old city clinics were options at the time. And I was really shocked at the number of private practices that would not accept out-of-pocket payment. They would only take you if you had insurance. Those groups are few, and frequently my doctor would do it as a quote-unquote favor because I had coverage and I had a relationship with them. That doctor would then charge us multiples of the same price that they would get from the insurance company who haggles with them about their price. So it's a crazy system, and it doesn't make any sense. Luis eventually got his papers and enjoys some legality within our even crazier and more illogical immigration system. And it was a great day. It was really a hallelujah day when the worry of a traumatic loss or cost would now be covered by insurance. It was the false positive. It was a false positive being accepted into this exclusive system that is all about creating limitations on what care you can get and from whom. This exclusion was just cited this week as an excuse for trans folks to be excluded from the military. That ain't right. When trans lives are under attack, what do? Stand up, fight back. When trans lives are under attack, what do? Stand up, fight back. So thank you for being here today for that. We are standing here with arm in arm with the trans folks that also demand great health care. This insurance system and its pools separate us from each other and the true bounty that we could all have with less stress about what we need to feel well, because that's all we all want to do is feel well. So Luis gets insurance. Insurance. We who have grown up here in this country are bewildered by it. Imagine coming from another country and in all of your years you had not heard of a deductible or a premium. Latinos are regularly the least likely to sign up for coverage, and I see the frustration in my own household. Doctors not in networks, claims denied, coverages that leave you paying for everything, even though it's insurance. Carriers not acknowledging premium payments that you've made. Carriers going out of business, like the Land of Lincoln program here in Illinois. Need I go on? No. Yes, actually I do. That's what we're all here for. Notices of discontinuation of coverage. Notices requiring updated immigration documents that be sent to you. Notably with the Affordable Care Act that Democrat passed legislation, they took extra steps to make certain that those out of immigration status would be excluded from the program. So in mid-year of your coverage, you have to give an updated notice to them that you still are within immigration status and just requires more documentation. And all of these communications from the carriers and from the government threaten coverage will be canceled and that you won't be able to enroll again until next January. In the meantime, immigrants in particular are disenrolled, and they show up to emergency rooms where they are at the back of the line due to lack of coverage. I have to tell you, this puts the fear of death in you. That ain't right. We are recognizing here today at this die-in what the CBO has verified are 29,000 deaths per year that occur under the current system that would not be, that are all about access to health care. 29,000 deaths.
That ain't right.
This puts the fear of death in us, this fear of not having insurance, and it also puts the fear of insurance in us. Durbin, and here in Illinois, Madigan and Ronner and all of you fools, you need to liberate us from this hassle of how the money flows and focus on health for all people.
What do we want? When do we want it? What do we want? When do we want it? All right. Our next speaker is Michael Grice. Michael is a member of the advisory board of the Department of Disability and Human Development at the University of Illinois at Chicago, a member of the board of directors of the Illinois Single Payer Coalition, a nursing home survivor, and a longtime disability rights activist. Do you want me to hold it?
Yeah. My name is Michael Grice, and I depend on my Medicaid for everything that I do, everything that has to be purchased for me. If it wasn't for my Medicaid, I wouldn't be in my own apartment today. My home services through the Department of Rehabilitation Services is tied to Medicaid. And unfortunately, the state has put caps on the amount of hours that my staff can work. And they've been told that they can only work 45 hours a week. So I'm fearful of getting that nasty letter one day saying that, Mike, guess what? You gotta go back to a nursing home. But I'm here to tell you, I'll never go back. I've already spent 15 years of my life in institutions. And being in institutions is, you don't have a life, because people tell you when to get up. The food is really lousy, but most important, the care is lousy. The state spent over $45,000 a year to keep me locked in a nursing home. If it wasn't for Access Living and other organizations and me being persistent in 2014 that I wanted to get out, I wouldn't be here today. I would probably be dead if I spent another day in a nursing home. $45,000 times 12. Just figure it out. 45,000. And I've saved the state a lot of money. But they're messing with my life. And when people do that, I fight back. I fight back every day of my life.
Yeah, you do.
I will never, I don't give a damn what the state, what the president says. I will never go back to another institution. because there are too many of our brothers and sisters locked away now that are trying to get out that can't get out because they don't have the supports that we need. And again, I can't stress this enough. If I didn't have Medicaid to pay for my home services, my medication, my wheelchair repairs, I would be stuck. But most of all, the last thing I want to say is, last November, I had to go to the hospital because I had a stomach virus. And the social worker comes in after 3 days. I said, I've only been here 3 days. I'm not well enough to go home. I still have the virus. Well, it's your insurance.
That ain't right.
I'm like, 3 days? You just want to give me some freaking pills and tell me to go home and then come back to the emergency room if I'm not feeling well? See, with a lot of people with disabilities, their health care is also tied to the managed care companies. So the managed care companies are the gatekeepers to what we do every day of our life. If we need anything, we have to go through the managed care companies to get their approval. We cannot do anything without their approval. You know, we're in a death trap. So if a tire falls off my chair tomorrow, I'm stuck. I can call my managed care company and speak to my coordinator, but she's not going to approve the repair right away. So that's the type of situation that I'm in, and a lot of my other colleagues are in that are in this terrible mess and fight. But I'm in it to the end, because the last thing I'll say is I'll die first before I go back to another institution. Honest to God, I will. I'll die first. Thank you.
Thank you, Michael. What do we want? When do we want it? What do we want? When do we want it? Ain't no power like the power of the people, because the power of the people don't stop. Thank you. That's my favorite one. I had to say it. All right, our next speaker is Deborah Lane. Miss Deborah has been employed by the Chicago Transit Authority for 26 years. Deborah has worked and trained in 11 qualified positions with CTA and is currently working as a rail operator. She's also a member of the Amalgamated Transit Union, Local 308, 3,000 active members strong. She holds the position of assistant board member, one of President Kenneth Franklin assistants, and has been appointed ATU 308 first organizer, assisting and mobilizing members in their fight for a fair contract against CTA. Please welcome Deborah. Do you want me to video?
Hello, everyone. Hello, everyone. We're not going to talk defeat. We're going to talk victory. We're not going to talk defeat. We're going to talk victory. Because we're uniting together for a better health care for all of us. As far as working conditions, as far as workers, health care, I've been employed with Chicago Transit Authority now for 26 years. We had wonderful, wonderful, wonderful health insurance until they blamed it on the Obamacare. Now we're paying $10,000 a piece, family insurance, per year, deductibles out of our pay. On top of what we pay for insurance plan coverage, we're still getting medical bills. On a personal note, I myself have diabetes and asthma, and I have to decide now whether I'm going to go to the doctor or not, because I don't want to pay these high-priced premiums along with the $260 I pay every month for insurance. Now look at me as a working person feeling this pain, and then transfer it back to an individual who has no income, minimum insurance, if any. And then look at these big politicians, how they're playing these male ego games about who's going to come up with the best insurance, and none of them have came up with a damn thing to help anyone. So now, thank God for single payers, and we hope that it goes forth, because we need affordable health care in this United States of America. When I go to Walgreens, it hurts me to see a senior citizen standing in line for their medication, and then they're telling the person, the pharmacist, to put some of the medication back because they can't afford it. So they have to gamble their health to the next month until they probably muster up some money to get enough insurance to pay for their medical. Where are the hearts in these individuals? They have no heart. So we have to be the heart that unites together and beat together to rewrite the wrong that has taken place in America with these big bankers, these investors who look at us as dollar signs instead of looking at us as a humanistic part. There should never be, ever be people dying because they don't have medical coverage. Ever. And you always hear, if you don't stand for something, you're going to fall for everything. We're not going to be that America anymore that's going to keep falling for these nice speeches, these nice, we got it, and then we're the ones that got it. We got the bills. We got the doctors that are rejecting us because they don't accept our medical insurance. It's what are we going to do as America now? We have to stand together, and we have to fight for what we rightfully deserve, and that's to live. God bless you.
Medicare for all. Now. Medicare for all. Now. All right. Our last speaker is Linda Jennings. Is Linda Jennings? Thank you. All right. Linda is a retired registered nurse from University of Chicago Medical Center. She is an active member and leader of National Nurses United. As a bedside nurse for nearly 40 years, Linda saw firsthand that the system of healthcare delivery in this country is broken. In her retirement, Linda has taken up the fight to demand universal healthcare for all by expanding and improving Medicare so that it is available for all.
Thank you. You want to hold this for me while I speak?
Sure.
Good with that. Okay, my name is Linda Jennings. For the press, that's Linda Jennings. I'm a member of National Nurses United, as she stated, and a retired nurse. I've worked for nearly 40 years at the University of Chicago hospitals and clinics. Of course, National Nurses United fought tooth and nail, along with many of you here, for Republican efforts to repeal the Affordable Care Act. And for now, we have claimed a victory. Every Republican bill that has pushed first in the House and now the Senate is a disaster that would punish tens of millions of Americans with higher health care costs and a lack of coverage. But just because Republicans are pushing a plan that is far worse does not mean that millions aren't suffering day in and day out today before repeal. Just this morning, news stories are reporting that a couple in their 50s took their own lives by jumping together from a 17-story building. Their suicide note read, "We both have medical issues, we just can't afford the health care. And our kids are upstairs. Please take care of them. This is needless suffering that must stop. When Democrats control the White House, Senate, and House, they made the decision to settle for limited reforms that left the insurance companies in the business of profiting from the sick. They left 28 million without health coverage. They left medical bills as #1 cause of bankruptcy. This is why Democrats are vulnerable to Republicans right now. Democrats need to seize the moment and lead the way for change we need. We call for Senator Dick Durbin to get it right this time. The public is ready for Medicare for all. We'll say that again. The public is ready for Medicare for all.
Yeah, we are.
Just the other day, Senator Durbin said the following: what we're going through now is the last grasp of public health insurance in America. As far as I'm concerned, if we can't make this work with the private health insurance industry, we start moving closer to a Medicare model. Well, Senator Durbin, I'd like to respond by quoting Martin Luther King, who said, "For years now, I have heard that word wait, and wait, and wait, and wait. This wait has almost always meant never. We must come to see that justice too long delayed is justice denied." We've already waited too long, Senator. Every day in this country, more people lose their lives or face financial ruin because they're sick. Now it's time to pass Medicare for all. Join us. So while D.C. is dealing with a purge, we're here to stand up and show out.
Stand up. Stand up. All right. What do we want? When do we want it? Senator Durbin, we ask two things of you. We need you to publicly support and demand expanded and improved Medicare for all now. Second ask, which is twofold. If Bernie introduces his Medicare for All bill, you need to be an original co-sponsor of it. If he doesn't introduce it, we need you to. And we need it now. The suffering has to stop.
Amazing grace, how sweet the sound that saved a wretch like me. I was lost, but now I'm found. Was blind, but now I see.